every time a stroke happens, every second a treatment is delayed, there are 30,000 brain cells which die.
People with previous history of heart attacks are also more prone to strokes?
Usually the risk factors for having a heart attack and stroke are same. So those people who have had a history of, a cardiac disease or a heart attack in the past, and they are not controlling the risk factors well, they are definitely at a risk of having a stroke.
Does stroke run in families?
Yes, absolutely yes. If there is something called as genetic, it usually comes earlier in the, the young generation. So if somebody had a stroke, say at 45 years of age, the children can start the screening early, maybe at 30s also.
What about women on birth control pills or pregnant women?
See, stroke usually kills more women than breast cancers in a year. Women who are on birth control pills definitely are at a higher risk of having a stroke, especially those who continue to smoke. So it's a deadly combination. If you identify that somebody is having a stroke, the only thing you can do is to reach a stroke ready center.
And what is sort of the timeline for that when you must reach?
So the point I want to stress is stroke treatment is possible only within 4.5 hours, but sooner the better.
Hello everyone, this is Khushbu Agarwal, founder at Zyla Health. A very warm welcome on the 19th episode of Conversations with Zyla. Today we'll be talking everything stroke. And the topic of the conversation is My Brain and Me, Preventing Strokes in the Young. A few days ago, a popular entrepreneur and founder of Zerodha shared a heartwarming post on social media. He said, "If there's one thing I wish I had done differently when I was hit by a stroke last January, it would be to go to the hospital immediately, within the golden hour, that is, less than 4.5 hours, instead of thinking I could just sleep it off. This nothing will happen to me attitude is common, especially among all of us under 50. But the truth is, strokes are rising sharply. Up to nearly 30% of all strokes in the last few years were among 30 to 50-year-olds. So today, to talk about this very important topic, I have with me the very talented Dr. Sahil Kohli, Additional Director of Neurology at Fortis Hospital, Gurugram. Welcome, Dr. Kohli. Such a pleasure to host you today.
Thank you so much.
Dr. Kohli has completed his MBBS, MD and then DM Neurology, followed by a prestigious stroke fellowship at AIIMS, New Delhi. He also practiced at AIIMS before moving to Fortis, Gurugram. He is widely recognized for his neuroscience abilities, including advanced expertise in treatments of stroke, epilepsy, Parkinson's, and other similar diseases. So, Dr. Kohli, to simplify the topic today, given stroke is not really a very well-known subject for our audience, could you really explain what really is a stroke?
So basically, stroke is also known as brain attack. Stroke happens when the blood flow to the part of the brain is cut off. Once the blood flow is cut off, there is usually oxygen deprivation, which means cells in the brain don't get oxygen. Those oxygen deprived brain cells die and the symptoms are produced. So basically, stroke can be divided into two parts. One is because of a clot in the brain which obstructs the blood flow, which is called as ischemic stroke, and other is because of the rupture of a blood vessel, which is called as a hemorrhagic stroke. 85% of all the strokes that happen are usually the ischemic strokes, and these are all time-dependent strokes.
Okay, so before we go into all of the symptoms and what to do if a stroke strikes, which is very critical, Dr. Kohli, let's understand who's at risk, right? So who can get a stroke?
Anybody who is more than 50 years of age, who has risk factors like diabetes, hypertension, continues to smoke cigarettes, has a sedentary lifestyle, has high cholesterol levels, has a family history of having a cardiovascular disease or a stroke in a younger patient, those who have a lot of stress, very active, sleep deprivation is a very important factor, or obstructive sleep apnea and some other cardiological illnesses, they're all at risk of having a stroke.
Right. So are you saying that people with previous history of heart attacks are also more prone to strokes?
Usually the risk factors for having a heart attack and stroke are same. So those people who have had a history of, a cardiac disease or a heart attack in the past, and they are not controlling the risk factors well, they are definitely at a risk of having a stroke.
And are young adults at risk too these days?
Young adults are, yes, at risk. Studies in India have shown that almost 10 to 15% of people contribute to the stroke total numbers that we get. So increasingly, because of the, a lot of smoking, stress, bad dietary habits, stroke is being recognized in young people also.
Right. You mentioned stress, long working hours. Are they related and how much really?
Yes, stress is a very important factor because in a tier one city life, everybody is busy navigating through traffic, less sleeping hours, less nutritious diet, more of a sedentary lifestyles. All these contribute to risk factors like having a high blood pressure, sedentary lifestyle to diabetes. So ultimately, these all add up and link to stroke.
Right. But Dr. Kohli, stress is really not avoidable when you're, working in a tier one city. You have to live with the perils of the city. So if stress is managed and the other factors such as lifestyle, sleep, diet, exercise, the risk factors of smoking are well managed, do you think then it's more preventable?
Yes, absolutely. The studies also say that almost 80% of the strokes can be prevented if we
Wow.
take care of all the risk factors well.
Right. And how are smoking and alcohol related, Dr. Kohli? What's the science there?
Smoking is something which needs to be, totally eradicated. Smoking is the biggest risk factor that we have. Smoking is 100% related to stroke. Alcohol in a very small quantity can be protective for a cardiovascular and a stroke risk, but the binge drinking has to be absolutely discouraged because binge drinking leads to high blood pressure, it leads to holiday heart syndrome and other complications. But one or two drinks once or twice a week in a small quantity are okay. They are rather protective for having a risk factors.
Right. And when we talk about smoking, Dr. Kohli, what is really happening in the body? Can you help the audience
So
understand the science?
smoking usually, once we smoke, we usually the nicotine and carbon monoxide. They're all irritants. They irritate the blood vessels and cause inflammation. Once the blood vessels get irritated, they develop hardening of the blood vessels, which is a process called atherosclerosis, which ultimately is the main center from where the clots get clogged up and they rise and reach up to the brain.
Is that also the reason why smokers have high hemoglobin usually?
Yes, that is a different mechanism, but yes, one of the reasons.
Got it. What about women on birth control pills or pregnant women?
See, stroke usually kills more women than breast cancers in a year, but we pay hardly any heed to this. So women who are on birth control pills, definitely specific type of birth control pills, especially those which have high estrogen content, are at a higher risk of having a stroke. Especially those who continue to smoke. So it's a deadly combination. On being on estrogen related oral contraceptives and smoking is definitely a risk factor for stroke in
Got
women.
it. Got it. And what about women who are expecting and maybe living with gestational hypertension?
So women who are expecting during the postpartum period, once they give birth to the child, that time the blood, it's a procoagulant state. That means the blood is thicker. It has a tendency to clot. So then there is a different type of stroke which happens usually, which is called as a venous stroke. Those are commonly seen after, pregnancy because of the blood thickening.
Got it. Got it. And can someone get a stroke even if their BP cholesterol were absolutely normal?
They can, because there can be some genetic factors which are contributing. There can be some environmental factors which can be contributing. Yes, they can.
Right. And now the elephant in the room. Does air pollution create a risk factor for strokes?
Air pollution, yes, studies have clearly shown that air pollution increases the risk of stroke. So basically, air pollution usually have two types of, things which cause stroke. One is a particulate matter. So the particulate matter, which is around the size of 2.5 pm, 2.5,
Right.
and the toxic gases. These can reach your lungs because we're inhaling them. Once they reach the lung, they get filtered into the blood. Once they go into the blood, they sometimes clog the arteries. That is how those people who are already at a higher risk of having a stroke, like, a artery which is already hard or which is already showing signs where there is cholesterol deposition. If these PM 2.5 like particles, they're like dust particles, they get attached there, further narrow the blood flow and increasing the risk of stroke.
Right. So while the other factors may be in our control and, we may give a lot of tips to people around lifestyle, how does one manage this one when, the air is not in your control?
Yeah, that's the biggest worry which is there right now. So what we can do is wear a mask and 95 mask in a place where those AQI levels are very high. Please use good quality your air purifiers in your rooms where you are living, you are sleeping, maybe you are working, and try to restrict your outdoor activities.
Got it. Got it. And have we heard of any such menaces in kids, adolescents recently, Dr. Kohli?
Stroke wise, yes, kids can also have strokes, but those guys usually have other pre-existing diseases, some cardiological disease which can cause stroke, or some other disorders of coagulation which can produce stroke in young children also.
Otherwise, it's uncommon.
Yes.
Got it. Now, talking about why strokes are striking the young, Dr. Kohli, and very, very important given the average age bracket of our audience watching today. Meanwhile, for our audience, I'll request you keep putting questions on the chat. We'll try to take a few with Dr. Kohli, while my team would address the rest we're not able to take up today. Thank you. So, why are younger people having strokes today? And I know you mentioned some risk factors already, Dr. Kohli, but can we rate them in order of importance, what you've seen most commonly in your practice?
Poor diet, lack of physical activity, more times on screens, sleep deprivation. They're not sleeping in the night, they're just watching some random stuff. And then, smoking, alcohol binges, too much of parties. These are all risk factors. Yeah, and yes, stress is also one important factor which is contributing to strokes in young people.
Got it, got it. And do you think our brain age has evolved over time, and the physical age is no longer same as a brain age given our lifestyles?
That's a difficult one to say, but then if we have balanced diet, regular physical activity, keep ourselves hydrated, the brains function well. If we take care of them well, they work well.
Right. And Dr. Kohli mentioned about poor diet. Can you elaborate on that and also cover aspects of maybe dehydration?
See what happens that this is a quick generation. We want food delivery in 10 minutes. So we all know that the quickly things which come quickly usually have stuff related to that. They are high in carbohydrate, they are high in fats, they have high sodium content,
Preservatives.
So all these quick things which are available instantly, they usually not good for health over a longer period of time. Once in a month or once in a fortnight is okay, but if we totally depend upon that, then our blood pressure tends to rise up,
Right.
the cholesterol levels tend to rise up, we tend to gain weight, and all these things ultimately go towards stroke.
Right. And what about dehydration, Dr. Kohli?
Dehydration is also important. Dehydration is very, very important. There is a specific stroke which is called as a venous stroke, which has been clearly linked with dehydration. But hydration, if we keep ourselves hydrated, our blood pressure remains under control, our sugars remain under control, and then risk factors, get controlled.
Got it. And you covered screen times, right? How is that linked to strokes? What's the science there?
See, screen time is indirectly linked to stroke. So suppose there is a person who has a screen time of 6 hours. So he would usually be sitting on a couch and watching the screen. Okay? Other than somebody who has a screen time of say less than 2 hours, he'll be watching the phone for 2 hours and he'll be active other times. So once all these things happen over a period of time, the risk factors tend to accumulate.
Got it. And maybe sleep gets impacted.
Yes, absolutely. So the sleep also gets impacted, and the blood pressure, sugar, high cholesterol, obesity, the core risk factors come into the picture.
Right. And is the blue light of screens also a risk factor?
Not directly.
Got it. And a big question we keep getting from our audience is on COVID and the post effects, risk of stroke. Is there any correlation there?
See, COVID was definitely a state, COVID infection was a state where it was a procoagulant, where the blood was thicker. We have clearly seen in practice that those people who had COVID had more chances of having stroke.
Right. So, Dr. Kohli, with that, we'll cover a couple of questions from our audience, and then, we'll talk all about prevention and treatment. For our audience, we'll pick a few questions, as I said, and the rest my team would address. A question we are getting is on, a stroke which doesn't have symptoms. If a doctor tells me that you had a stroke, what do I do next if I didn't get to know or there's no symptom or repercussion as such?
See, if you spot a stroke, if you identify that somebody is having a stroke, the only thing you can do is to reach a stroke ready center. See, it is a little different from a cardiac attack, because in cardiac attack, if somebody can take a aspirin directly before reaching to the hospital, but in case of a brain attack, we do not know whether it's a blood clotting related stroke or a hemorrhagic stroke. So we can't give much of the medications. So we have to try to reach to a stroke ready center immediately. And what is a stroke ready center? Stroke Ready Center is a center where there is a 24/7 CT available. So because once we do a CT of the brain, we know it's not a bleed. Then we can start off the medications, which unfortunately cannot anything can't be done at home. You have to reach to a Stroke Ready Center.
And what is sort of the timeline for that when you must reach?
So after a stroke, within 4.5 hours, we give something which is called as a stroke thrombolysis. It is the definitive treatment for stroke, and it is absolutely standardized anywhere in the world. Even in those 4.5 hours, those people who reach a stroke ready center within first 90 minutes, they tend to have better outcomes. Those people who receive treatment from 90 minutes to 3 hours, they can have slightly, lesser good outcomes. And those who reach within 3 to 4.5 hours, still less. And after 4.5 hours, whatever we do, treatment or, the subtyping of stroke, it is usually to prevent another stroke.
Okay.
So the point I want to stress is stroke treatment is possible only within 4.5 hours, but sooner the better.
Right. And then one question we have here is, Dr. Kohli, can stroke happen in sleep?
Yes, absolutely yes.
Okay. So in that case, person gets to know only when they wake up, or do you think?
It's a little challenging situation for us also, but we call this as a wake up stroke. So once somebody gets up in the morning, they feel that they can't move their right side of the body. So we do not know what time the stroke has happened. So there are some special sequences in the MRI which can sometimes predict if the stroke has happened as the early part of the sleep or in the later part of the sleep. So depending upon that, we can give medications or thrombolytic benefit to the patient.
Got it. So we'll cover some signs and symptoms now, Dr. Kohli. Very critical that our audience knows that and acts upon that. What are the first signs of a stroke?
See, for identification of a stroke, we don't need to be a neurologist. We just have to remember a word called B fast, where B means sudden onset of balance problem. E means sudden onset of eye problems, that means inability to see or blurring of vision. F means sudden onset of facial drooping, like you're talking to somebody, they suddenly the face gets deviated on one side. A means sudden onset of arm weakness. S means sudden onset of speech problems. And T is time. Time is 4.5 hours. So it is BEFAST. If we remember this word, anybody can easily identify stroke. One more thing. So there is another word in Hindi called bachav, where B means baju ka kamzor hona, Ch means chehre ka teda hona, A means आवाज का थरथराना, and V is वक्त, which is 4.5 hours for the definitive treatment for stroke.
That's great. I'm glad you shared it in both languages. And you mentioned blurred vision or slurred speech, but that can also happen for other disease conditions. So how does one differentiate?
Suddenness of the symptoms.
Okay.
If somebody has slurring of speech which has started suddenly, so it can be because of a stroke. And similarly with the blurring of vision, which has suddenly started, like you were talking on the phone or maybe you were eating your food and suddenly there's a blurring of vision, it definitely warrants a investigation for a stroke.
Right. And sometimes we hear that this person had a mini stroke. What does that mean, doctor?
So mini stroke is a stroke where the stroke symptoms happen for some time and they improve, and then they happen for some times or improve. So I'll give you an example. There was a patient who was driving a car. So he was driving a car on a highway and he suddenly realized his hand was not coming through for the left hand for the gears. He pulled over and waited for 10 minutes and it improved. And then he again started to drive. But again, after half an hour, he realized that his hands were not coming through. So the left hand was not, again pulled over. This time the duration was even more. He did some massage and moved on. But then ultimately, when it happened for the third time, we couldn't prevent it. So the mini stroke is also called as a transient ischemic attack, where a transient is like a shorter duration, ischemic is clot related, and attack is stroke. So all these symptoms give warning signs before coming. If we catch them early, like the first step where he had weakness of the left hand, maybe we would have prevented it.
So he should have reached a stroke ready center or hospital right then.
Absolutely.
Okay, so you're saying if you delay it thinking that I'm feeling better now, then later it may become a more massive stroke.
Yes, it may become a full-blown stroke.
Got it. That's very, very important for our audience to note. That if you have even symptoms which are transient and temporary, it's important you reach a hospital or a stroke ready center and don't wait. It's okay to get checked, and even if everything's normal, it's fine.
Yes.
Great. So, Dr. Kohli, you spoke about the golden hour, the 4.5 hours until when the person must reach the hospital. But sometimes people think that let me try to self manage and I'll see to it in the morning, especially when the symptoms happen at night. So what is your guidance there?
See, every time a stroke happens, every second a treatment is delayed, there are 30,000 brain cells which die. So those people who receive treatment early are more likely to get back to their work on time and have less disability. Those people who receive treatment after 4.5 hours, they are usually not going to completely get better and may have some disability left. So it is said that those people who receive treatment within first 90 minutes, 1 in 4 can be absolutely normal. Those who receive treatment within 3 hours, 1 in 9 can be absolutely normal. And those who receive treatment after within 4.5 hours, from 3 to 4.5 hours, the number needed to treat is 1 in 14. So you see, if somebody gets treatment within first 90 minutes, the chances of recovery or getting back to work or being absolutely normal is 1 in 4, which is very good.
So it's important to get to a hospital or a stroke ready center immediately. Now, talking about some preventive steps, Dr. Kohli, one is on the risk factors itself that you mentioned around blood pressure, diabetes, cholesterol. How important are they, and what do we mean by managing them and reducing risk of stroke?
80% of the strokes are preventable. So we have to control our hypertension. So there's a saying about hypertension that 50% of people who have hypertension, they do not know they have it. And those who know it, out of which only 50 of them are having a treatment. So wow. Yes, so everybody who is more than 35 years of age or 40 years of age usually should have a BP checkup at least once a year. And if they get a BP checkup, they should be on medication for that. So in practice, what we see, many people start off medications, but they think वो तो normal हो गया और वो खुद ही बंद कर देते हैं. Then it gets rebound. So BP has to be absolutely controlled well. Diabetes is the second biggest risk factor. Again, has to be controlled well. HbA1c has to be controlled, which is a 3 months average sugar. It has to be looked at. They should have good physical activity. Avoid sedentary lifestyle. If somebody can do strength training with little bit of weights, their weight will come down faster, their sugar will get controlled, and they have a better blood pressure control. People who eat a lot of fried foods or a lot of fast foods, they tend to have high sodium content, which again leads to high blood pressure. And the calories are also on the higher side, which leads to higher sugar. So many times people say कि हमने चाय तो बिना चीनी के पिया है, but we have taken 2 biscuits with that. So what is happening? All the sugar that they could have avoided while taking a tea without sugar, they are already eating it with a biscuit.
Right. One thing I've seen, Dr. Kohli, is that people don't look at the packaging, right? While it may look like a healthy biscuit or may be marketed as a healthy biscuit, the amount of sugar, the amount of sodium, as you're saying, in it is very, very critical to watch.
Ideally, no biscuit is a healthy biscuit. Biscuits are absolutely to be discouraged because they will ultimately, spike up your blood sugar and increase your blood sugar. And over a period of time, with the continuous ingestion, are going to create more problems.
Right. We did a podcast with a senior doctor who said avoid anything which is shiny and packaged.
Absolutely, I agree.
And what about cholesterol?
High cholesterol is a risk factor. See, cholesterol should be controlled well with medication and physical activity and weight reduction. There is a common saying कि हम तो vegetarian हैं, हमें तो cholesterol हो नहीं सकता. But then if you ask them closely, they will say कि we are drinking 1 liter of milk every day. So all the products which come from the animal origin, they are the usual source of cholesterol. So it's a myth that only vegetarians can't have high cholesterol. So if they keep taking milk products which are higher fat content, the cholesterol can go up. And on the other hand, even if your intake is very good, there's a family history of having high cholesterol. Anybody with a fit lifestyle and eating everything, they still can have high cholesterol.
Right. And in case of BP and cholesterol, Dr. Kohli, sometimes lifelong medicines are prescribed, especially for people above 35 years of age. Are they safe to take?
Yes, very safe.
And one must be on it then as per your doctor's guidance.
Yes, periodic checkups are important. If the levels are coming down of the cholesterol, doctor will definitely try to reduce the medication. But if they are not, then you have to take it.
Right. And you mentioned weight gain. So is obesity a risk factor as well?
Obesity is a big risk factor. Obesity is basically a syndrome where blood pressure comes in, your diabetes comes in, your high cholesterol comes in, and indirectly also means sedentary lifestyle. So it's a it's like a cocktail waiting for a high stroke chances and cardiovascular.
So they're all related.
Absolutely.
Got it. And what's the correlation between exercise and stroke prevention?
Exercise is very important. Exercise, a daily physical activity like, taking 10,000 steps in a day, or being physically active at least 4 times a day, going for a walk, doing strength training, doing swimming, playing any kind of a sport, being physically active cuts down your risk of having a stroke.
And why is that? Like, what is the science behind this?
See, once you start to walk, suppose I give you a simple example, your more calories are burnt. Your good hormones or endorphins are released. So they cut down your stress levels. So all those changes get reflected into your body. And if you have diabetes, your diabetes will be better controlled with physical activity, and your blood pressure will be better controlled, and then ultimately leads to a good quality of life and cutting down the risk factors.
Got it. So you're saying your risk factors are better managed and you also reduce your stress.
Yes.
So overall you reduce the risk. And how about meditation and yoga? Have they been linked to stroke?
Meditation and yoga also have been shown to cut down your risk factors. So anybody who has hypertension and those who have high stress levels, if they do periodic yoga for at least 30 minutes or 3 to 4 times a week, they have been shown to reduce the risk of having a stroke.
Right. And is there any correlation of deep breathing?
Deep breathing is a kind of meditation only. Yes, it has a preventive aspect.
Right. And a lot of people jump to supplements, Dr. Kohli, like omega-3 fatty acids, vitamin D, vitamin B12. Are they correlated to stroke risk prevention?
See, vitamin B12 deficiency can indirectly be associated because it is there is a correlation between high homocysteine levels and having a stroke. So low B12 can indirectly increase your risk of having a stroke. But studies have also shown that vitamin D, in low levels of vitamin D have led to, poor recovery in patients. Definitely, yes, I agree with that. Omega-3 fatty acids, if they're taken in moderate quantity over a period of time, they also have shown to reduce the risk of stroke because they're all antioxidants. And the inflammation that is produced in the body because of be it smoking, be it stress, they tend to cut it down.
Got it. So would you say that if you're getting a preventive annual test done, the vitamin inclusion in that, vitamin D and B12, would greatly help?
Yes. Thyroid, HbA1c, vitamin B12, vitamin D, cholesterol levels, these are basic which should be checked every year.
Along with blood pressure.
Along with blood pressure.
Got it. Now talking about caffeine, Dr. Kohli, how is that linked to brain health?
Caffeine again has, it's like it has a dual effect. So caffeine, 1 or 2 drinks a day are usually, preventive. But if the dependence of caffeine is more, like somebody takes 6 to 7 cups in a day or 8 cups in a day, it tends to increase the pulse rate and tends to sometimes increase the blood pressure, which is a core risk factor for having a stroke.
Got it. And we've also seen, Dr. Kohli, people in India, take heavily milked tea, which is more on the side of milk than water, and it's also full fat milk. You mentioned that dairy milk particularly is not great for overall weight management and calorie intake.
For somebody who is young, who doesn't have any risk factors, they can take anything. But those people who are having high on cholesterol, diabetes, they should try to take milk which is, a less fat milk, like a double toned milk, which has only 1.5% of fat. So that milk can help them, keep their taste together as well as be less on fats and carbohydrates.
Right. So just deep diving into the diet aspects now, Dr. Kohli, are the other forms of dairy such as curd and paneer they seem to be better than milk overall?
Curd is important. Curd is important because it acts as a probiotic. So many other neurological conditions, they have found the origin be in the gut. So curd definitely keeps your gut clean. It's a probiotic and it helps in an overall, well-being. And paneer is a good source of protein for people who are vegetarians, like in our setup, to keep their muscles healthy.
Right. And if you have to guide your patients on foods to take more and foods to avoid for overall brain health and stroke prevention, what would that be?
For that, they have to, take a lot of proteins. So the proteins will keep their muscles, active, and they'll they can build up more muscles while taking proteins. Whereas if they take only carbohydrates, which is usually our diet, so carbohydrates will ultimately get converted into fat over a longer period of time. So high carbohydrate diet is usually for people who are very active, who are doing manual labor kind of work. But these days, when most of us are sitting the whole day. So the carbohydrate intake has to be reduced a bit, and more focus has to be on proteins.
That answers the question when people say हमारे ancestors भी तो यही खाते थे, but they used to have a lot of laborious work. You're
Yes,
saying.
absolutely.
Got it. Now talking about genetics, Dr. Kohli, a very very important aspect. Does stroke run in families?
Anybody who has had a stroke or a heart attack less than 40 to 45 years of age should be screened for a genetic cause.
Their family, you mean?
Yes. And indirectly, if somebody has a high family history or a strong family history of diabetes, hypertension, or a cardiac disease, then it's again a risk factor. It's a genetic kind of scenario where high blood pressure transmits from the parents to the children. They pick it up very late, thinking we are young, we can't have it. But then most of the damage is already done. So those people
Right.
who have a family history should have a periodic checkup even earlier to pick it up high blood pressure, sugar, and control it.
Right. So while BP, cholesterol, diabetes is in every family, Dr. Kohli, unfortunately, and an annual checkup you mentioned is important for that. But you're saying if someone's family member, say a parent or a sibling, had a stroke incident which is less than 40-45 years of age, then what is the guidance for the rest of the family?
They should have an annual checkup of their blood pressure, their sugar, HbA1c. If somebody has a disease in the arteries, they can get a carotid Doppler to check how the arteries going into the brain are doing. Echo is also important. ECG is also important. If they check all these things, I think they can prevent it.
Okay. So they have to just maybe start sooner. At what age then?
Earlier. So if there's something called as genetic, it usually comes earlier in the the young generation. So if somebody had a stroke, say at 45 years of age, the children can start the screening early, maybe at 30s also.
Okay. Got it. And is the same for, say, the women child as much as is for the male child?
Absolutely. Both same. Same for both.
It's the same. Got it. Now we'll take few more questions from our audience that we are getting, Dr. Kohli. One is, if I had a mini stroke, is it safe to fly after that?
If you had a mini stroke and you got evaluated for that, you got your heart checked, you got your blood vessels in the neck checked, you got your cholesterol and other things checked, and you are on medication, and I think after 72 hours or a week, you are safe to travel, yes.
Okay. And what about exercise after a stroke? Is that safe?
That depends upon the type of stroke. So if it's a bigger stroke, we definitely need a gradual physiotherapy or exercise regimen. But if it's a minor stroke which recovered almost completely, you can start off your physical activity sooner.
Okay. And can stress or anger trigger a stroke?
Stress or anger, yes. If somebody has a bout of anger and it suddenly spikes up their blood pressure, they can have something called as a subarachnoid hemorrhage or a bleeding kind of a stroke. It's not that they can't have a ischemic stroke, but a sudden rise in blood pressure can have a bleeding kind of a stroke, which is more common.
How heart attacks also may happen in such a case.
Yes.
Got it. Is it possible to fully recover after a stroke if one reached the hospital after 4.5 hours?
Yes, you can still do that, but then you will be very lucky for that. And it may be a part of the area of the brain involved which is not, major deficit producing. But if somebody's language is involved or somebody's right hand is involved, then it becomes a little difficult because it takes time in recovery.
Are Indians more at risk for stroke?
Yes, Indians, we are the diabetes capital of the world. We're eating too much of carbohydrates. There is lack of physical activity. We are living in pollution. We are definitely at risk of having more strokes.
I think this question we get in every podcast, Dr. Kohli. Which oils are better for health?
See, our old refined, not the refined oil, all the, the kachi khani ka tel that we use is usually because it has been used by our people for a longer period of time. I usually recommend that only in a moderate quantity.
Right. Is non-veg safe for stroke prevention?
Non-veg, if done over. So if we continuously keep increasing taking non-veg, not the chicken kind of a thing, but the mutton kind of a thing where there is a lot of fat involved also. It ultimately going to increase your cholesterol. Leaner meats are more advisable.
Non-fried and
leaner meats, yes.
Got it. If my BP is constantly 140/90 or more, can I manage with lifestyle and not medicine?
Yes, you can manage, but then you need to check it regularly. It's not that you start off your lifestyle routine and then you miss it over a period of 1 month. But then you can get a periodic BP monitoring, be physically active, take less salt, get hydrated, and I think it can be managed.
Got it. And we'll take the last one, Dr. Kohli. Is borderline cholesterol and triglyceride also harmful?
Borderline cholesterol, I think the guidelines say that cholesterol levels should be less than 100. The LDL levels and total cholesterol should be less than 200. If you're on the cusp, then be physically active, reduce it to the standard levels, and then there will be less risk.
But that changes if you have a very strong family history of a young person having a heart attack or stroke, right? Dr. Kohli, you would start preventive medicines.
Yes, I would.
Even for borderline cases.
Even for borderline cases, and we keep monitoring that. If they fall below the normal levels, we may even reduce the medications and stop also.
Got it. What is, sorry, I'll just take one more given the number of questions we're getting, Dr. Kohli. What is the role of blood thinners in stroke?
So blood thinners, once that 4.5 hours window period is gone, we start off the blood thinners so that there is no, there is no thickening of the blood and there is no reaggregation of the clot there. So once a stroke happens, usually the blood thinners go for a longer period of time for ischemic stroke.
Got it. Great, Dr. Kohli. I'm sure the audience has more questions which our team would address, but thank you so much for sharing your lifelong learnings with us today. And on a very important subject, much lesser known, whenever we talk to our patients, a lot of them think stroke happens in the heart. It is so lesser known, actually, and so important to spread the knowledge. Any last minute thoughts you want to share with the audience?
Heart attack is different. Brain attack is different. So the brain attack or stroke is a time-bound medical emergency. So if anybody spots a stroke or sees somebody having a stroke, it can happen, while you're having a dinner somewhere in an office or while traveling in a metro. You have to guide them properly, because if they miss that 4.5 hours window, we usually miss, the chances of reversing that stroke. If you spot somebody having a stroke, please send them to a stroke ready center and do not wait for the things to recover on their own and reach hospital in time.
Right. There is no home management or self-management. Yes. Great. Thank you so much, Dr. Kohli, for being with us today. It was such a pleasure hosting you, and thank you, Fortis Hospitals, for allowing you to spare your busy schedule for this. To our lovely audience, thank you for being with us. I hope your questions were well answered, and Dr. Kohli added a lot to your learning today. We'll see you again on the 20th episode of Conversations with Zyla. Till then, take care and please take care of your health.